Hello, I'm Dr. David Clark. At Health+, we are known, we're kind of well known for doing what we call whole body examinations. And when people come into the practice, they don't know what to expect. And they kind of are interested in, why do we do that? My stomach's hurting. Why are you looking in my eyes? I'm constipated. How come you're looking down my throat? Why are you looking at my tongue? So here we tend to look at the whole person. In what we call alternative medicine, part of alternative medicine is holistic, and holistic really means taking a look at the whole person. When I was a young doctor, which was shortly after the Civil War was over, no, I'm kidding. When I was a young doctor, I practiced in a very rural community in Iowa, and Iowa is adjacent to Minnesota, and in Minnesota there's a little town called Rochester. And right after the Civil War, a doctor named Mayo decided to open a clinic there. And for decades, the Mayo Clinic was famous for doing whole body examinations. That was their big thing. They don't do that so much anymore, but that was the thing. You would go every couple of years and they would check you top to bottom just to see how everything was. And in part, that's what we do. So when somebody comes into us, the number one complaint that we see here at the practice is fatigue. Most people would say, oh, I could stand more energy. Some people are very, very debilitated. They're very, very run down because they don't have energy. And so when they come in, we're going to check all kinds of things. We're going to check blood pressures and how well their lungs work and how their heart's working and how their arteries are functioning. And when I do the physical exam, typically I'm going to start at the top and work my way down through the body. Why would I do that? Most doctors don't do that anymore. So what's the point of us doing it? So I'm going to step you through some of the things that are behind our reasons. Now, I tease a lot about the old spiritual song, the toe bone's connected to the foot bone, and the foot bone's connected to the ankle bone's connected to the what bone comes next? The elbow or something like that. Because we are whole people and we get clues from the entire body as to what's going on with an individual. So that's why I start at the top and work my way down. So even though your primary complaint might be you have a tummy ache every so often, or every time you eat such and such you get indigestion, or you've had some heart issues, I'm going to start at your head and work down. So for example, we'll look at your eyes. And we had a patient recently with a knee problem. He said, remember, it's a knee problem. I said, yeah, I got that. I'm going to start with your eyes and work down. So we look at eyebrows, because eyebrows will give us an indication sometimes, give us a clue about how the thyroid's functioning. Believe it or not, when the outer third of the eyebrows gets thin, not from overwaxing, it's commonly going to be a thyroid-related problem. We look at the coloration around the outside of the eyes. Dark circles around the eyes are commonly associated with allergies. They can be associated with digestive problems, including something like chronic constipation. We're going to take a look at the pupils and see how the pupils respond to light. What kind of information do we derive from that? Well, real commonly, when a person has an adrenal gland problem, the pupils will constrict. They'll get small when I shine light in, but then they can't stay small, and they very quickly open right back up. They let in too much light. And many times, not always, many times that's associated with an adrenal gland problem. So just those few little things about the eye are going to give me some insights, some possible insights. What's going on with this person's overall health? One of my mentors many years ago taught me something very, very simple. He said, fix what you find. Don't be mesmerized. Don't be drawn in by what the patient's complaining about. Find what you find and see what you can do to fix it. So sometimes, let's go back to that person with the fatigue for a minute. The most common reasons for fatigue are going to be related to something like anemia, maybe an adrenal gland problem. Can be all kinds of things. And so we want to find what it is that's causing the fatigue. Find what it is that's causing the symptoms of indigestion or whatever it happens to be. We take a look at a person's mouth. One of the reasons we take a look at their mouth is to check their gums, not just for things like gum infections. We see that a lot, or a certain type of a chronic pyorrhea, but we also are looking for something, the color of the gums, and for shrinkage of the gums. So we call that recession. And we talk, I checked with my staff recently, do you know what the expression long in the tooth means? And nobody did. Not enough farm people here, or they're all way too young. So in horses, and people aren't horses, in horses the teeth never stop growing. And so one way to kind of get an idea of how old a horse is to look at how much tooth is showing. Well, in humans our teeth don't keep growing, but our gums can shrink backward. And the number one reason for people who, let's say, are 40 years old and older, for their gums to start to shrink back, which means their teeth look longer, they're not really longer, they just look longer, is because of hormone decline. Who would have thought, huh? So we look at that type of a thing, we look at the tongue. The tongue can tell us tons and tons of things. The most common things that the tongue is going to tell us. And we check everybody's tongue. Who would think, but the tongue gives us a lot of clues, especially about vitamin levels in the body. So we look and see if there are cracks in the tongue, so the tongue is evenly coated, if there are extra bumps on the tongue, because those are very commonly associated with B vitamin deficiencies. We look at the edges of the tongue, and if they're nicely scalloped, usually it means that person's been dehydrated for a long time. So we're checking, we're going to check the throat, we're going to check the front of the neck, to see what's going on thyroid-wise. Oftentimes we'll find a thyroid problem that way before we even see the laboratory tests to make that evaluation. Listen to the circulation that goes into the neck through the carotid arteries. We listen to the heart. We're checking for murmurs, which are actually presently commonly being overlooked. We've already done an EKG by the time I start with the exam, and I listen to the intensity of the heart sounds. That's an old trick that doctors used to use, is to listen to how loud is the S1, how loud is the S2. Are they a nice clear sound, are they split? It gives me some guesses, it gives me some insight as to, is it possible that this person has a mineral deficiency? Is this person dehydrated? Does this person have a tendency for congestive heart failure or cardiomyopathy? Is maybe the adrenal gland too fatigued and the heart can't beat quite normally? We're going to check the lungs and see what's going on there. Do we have scar tissue? Are the lungs healthy? Are the lungs being compressed because of a problem with the rib cage or because of the heart being enlarged? We're going to feel carefully around the abdomen. And finally, for the person who has a stomach problem, they're thinking, okay, now you're kind of getting to the right spot. So we check and see, is there any place that has abnormal tension? Is there any place that has tenderness? Because each one of those places that may be tense or may be tender give me insight. Could we have a problem with the gallbladder, with the liver, with the stomach itself, the actual stomach, with the spleen? We check the kidneys. None of those places should be extra tense or shouldn't be extra tender. So we're going from top to bottom with pretty much every patient. Most of our patients come into the clinic with a chronic health problem, meaning they've had it for months or years. If you come in and you stubbed your toe real hard on the step or when you got out of bed some morning, we're probably not going to check your eyes for that. That's an acute problem. But people who have a chronic health problem, we're going to look everywhere because we want to have the best total idea, the best total picture of your health and what may be a problem. The same way when we do laboratory testing, when we do blood tests and urine tests, we're checking all kinds of things. In what is a routine laboratory panel for us, we're checking over 60 different items, which is more than almost anybody else does, because we want to see what's working right, what's not working right, what may be a deficiency, because deficiencies can be very easily corrected, because if there's a particular dysfunction, usually we can help it. Now, yes, we are also checking for diseases, but when we're doing functional medicine, we're actually looking at how is the body working. An example that I sometimes give to some of our Amish patients is a wind-up clock or a grandfather clock. The clock is still working, obviously, because you came to the office. What I'm checking for is to see if it's running too fast or too slow. Is it keeping the right kind of time? So when you come to Health+, you can expect with a chronic health problem that we're typically going to check your arteries, your lungs, your heart, even things that you don't even think there's a problem with. The other reason we do it is for the same reason that the Mayo brothers used to do it, is to be able to check a person's health all over every year, every 2 years, and just see how things are. Because everybody agrees that if we find a problem early, it's a whole lot easier to work with, to improve and even correct than it is if it has been well advanced. So when you come to Health Plus, take your time, expect us to spend some time with you, expect us to check some things that you've never had checked before, so that we get a total picture of your health, and so we have the best idea possible as to how we can help you have the best health possible naturally.